During the initial interview, I'm going to do a comprehensive interview where I'm going to find out exactly what's going on now. What are the symptoms? Is it memory loss? Is it attention? I'm going to want to know about the activities of daily living, like cleaning, shopping, hygiene. Is the person able to cook, pay their own bills? How are they doing with medications? Is there any family concern about driving? So we're going to get a whole picture of what's going on now. And then we're also going to look at the person's history. Has there been substance abuse? Has there been mental health history, learning disabilities? What does the medical history look like? So a family member who's assisting in this wants to come with all of that information or any kind of medical records that are pertinent. Some people come in with a history of falls or a history of concussion, and that may look like it's a dementia when it's actually, a post-trauma history. So we want to look at the whole background, and then depending on if the person's coming from a primary care and neurologist, then there's no reason to do a small screening. We're going to set them up for a 3 or a 5 hour test, depending on what I hear is happening. We have the person take breaks. Now we have mask breaks and water breaks, and people can bring snacks. And so it's a comfortable process, and it's not like you're working straight through, and you are working with someone. So a lot of times people think we're going to hand them a test and walk out like it's the SATs, but we're really working, and the tests are basically a tour of the brain. So we're looking at all brain function, because sometimes someone may come in with a memory problem and it is actually an attention deficit and not a memory problem. Or sometimes the pattern that looks like it's cognitive is actually a major depressive episode that looks more like a dementia. So there's a lot of different patterns. So what we need to do is test all of the brain functions, not just the complaint. So what does that look like? We look at language, because a lot of times when people have mild cognitive impairment or dementia, we see changes in their word finding ability and their fluency, specifically an area called semantic fluency. Because when we use semantic fluency, we have to kind of reach back in our memory to pull out words that are in categories. So that's that's a pattern there that we'll see. We look at attention span. So we might test immediate attention, and we're also looking at sustained attention for some people, because, if they're living independently, we want to make sure, is the person able to maintain that attentional set, or do they walk away from what they're cooking and become a hazard or unsafe? We're also look at memory. We don't give one memory test, we give several, because sometimes someone's verbal memory may be intact, and then the visual memory may be impaired. So we want to see a pattern of that. So we're generally looking at narrative memory. We can look like we're having short-term memory issues, but then when we're cued or we organize things, so that, we're better able to recall them. So we look at all the nuances of the visual memory, the verbal memory, and how that plays out, because that's one of the primary complaints. We also look at visual perception, and we look at executive function. So scanning, sequencing, tracking, problem solving, decision making, some of the higher order thinking, and then your ability to kind of track and multitask and sit and set shift. So those are all the areas that we test. And then when we're finished with the testing, we sit down with families and go over the results. And one of the questions that I'm asked a lot is, well, I'm 90 years old. How is it supposed to sound? But we're comparing you to your same aged peers with the same level of education. So we're really trying to find the normative set that matches you the most, so we can get a really good idea of, are you falling? And then we also have tests of premorbid function. So based on your occupation, based on the tests that we give for premorbid function and your intellectual functioning, we have a pretty good idea of whether you should be coming up average or low average or above average on these tests. And then we can gauge whether there's been a decline.